Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Welcome and thank you for joining Axxess for Rethinking Home Health Staffing, How to Plan for the Future of Nursing. Today's webinar is part of our ongoing series of educational webinars to assist you as healthcare leaders in addressing today's most pressing issues. My name is Deborah Hoyt. I'm Senior Vice President of Public Policy for Axxess. Today, I'm delighted to host a panel of 3 national experts who will provide you with tangible and actionable solutions to addressing what is becoming a crisis of national proportion. We all understand that the COVID pandemic has changed healthcare for the foreseeable future, transitioning the future of healthcare delivery from inpatient facilities to people's homes and community-based settings. This shift in care delivery settings requires that nurse education and curriculum be updated appropriately to meet the diversity of skills and thought process required by caregivers in the home. But we'll hear from our guests that the scale of such change is not easy. Our nation is struggling with a significant workforce shortage, specifically amongst home health nurses, aides, and non-medical in-home support staff. Today, our panelists will offer a fresh perspective of workforce trends, recent studies, and federal and state assistance, including funding, to address today's most pressing challenge while preparing the healthcare workforce of the future. It's my pleasure to introduce our panelists, Marcia Proto, Executive Director, Connecticut League for Nursing and Connecticut Center for Nursing Workforce, Susan Reinhard, Senior Vice President and Director, AARP, Public Policy Institute and Chief Strategist, and also the Center to Champion Nursing in America and Family Caregiver Initiatives. And finally, Jana Bitton, President of the National Forum of State Nursing Workforce Centers and Executive Director of the Oregon Center for Nursing. Welcome, ladies. I will now turn it over to Marcia to begin our panel discussion. Marcia, I believe you're on mute.
Thank you, Deb. Excuse me. Welcome everyone to the webinar, and thank you, Deb. Before I begin our conversation, I'd just like to share our objectives and takeaways for our attendees today. We're going to be understanding the key findings of the Future of Nursing 2020-2030 report. We're going to learn how data is being used both on a national and statewide basis to inform nursing workforce development to meet our supply and demand dilemmas. We're going to gain some insights into federal actions to offer options for Medicare beneficiaries by allocating federal funding to increase in-home healthcare delivery in the United States. And lastly, act on data findings to understand how you can improve your current staffing situations, as well as engage in diversity, equity, and inclusion activities as you begin to build a successful staff to care for your patient and client populations. As the overarching goal of the Future of Nursing 2020-2030 report by the National Academy of Medicine mentions the important role of nurses in achieving health equity for our country, I'd like to invite Susan to talk a little bit about what that means and why it's vital to ensure nurses' well-being as the demand for nurses increase in the future. Susan.
Hi, thank you. So first of all, I want to thank you for this opportunity. I began my career as a visiting nurse, so home care is deeply embedded in who I am and hopefully what I do. So thanks again. But before we get into the Future of Nursing report, I just want to give a little history to what the center is about. So 2007, I can't believe it's been 14 years, the Robert Wood Johnson Foundation, which is the largest philanthropy dealing with health, approached the AARP. I had just come to the AARP, and they asked us, the AARP and the AARP Foundation, to create what is now known as the Center to Champion Nursing in America. And people ask why AARP. You can see why RWJ might like it, since, bragging a little bit, this is like the largest membership-based organization in the entire world. So, okay. But why AARP? Why did they want to do that? So clearly the members, we have about 38 million members, are often the patients, right? Or the family caregivers. So it certainly made a lot of sense that we would care that every person should be able to receive a highly skilled nurse when and where they need one. And that became our mission. And then shortly thereafter, you mentioned the National Academy of Medicine started the first report in 2010. And it was called The Future of Nursing, Leading Change, Advancing Health, 2010 to 2020. The years just go booming along here, I realize. So it had a lot of recommendations we've been working on. I serve as the chief strategist, as you noted in my introduction, of the center, but also of the campaign for action it's called, which I co-lead with Dr. Susan Hassmiller, who is the senior advisor for nursing at the Robert Wood Johnson Foundation. So we spent a lot of months, many months now, working with nurses, and we call them nurse champions across the country. I'm going to put it up. I don't know if you can see it. That's the report. Tons of recommendations that we can talk more about in a moment. I think during our Q&A, we can talk a little bit more about that. But before we do, I want to mention the Choosing Home Care Act, Choose Home Care Act, which, of course, again, as a visiting nurse, I really like this. But I have to say that AARP does support this. I'm sure most of the people listening in know what that means. It's about supplementing the existing Medicare home care benefit, and it would give hospitalized older adults who are eligible to recuperate in a skilled nursing facility to instead recuperate at home, which so many people would prefer. So we can get back to more about the campaign in a moment.
Thank you, Susan, for the introduction and also the clarification. And it is amazing that the campaign has been around for numerous years and actually has really made an invaluable contribution at each state level to really move and champion the voice of nursing within each state. Deb, you also shared in your introduction related to the impact of nursing education. And I think what we've seen even before the pandemic was that to really provide our nurse to enter the practice, especially in home, we really need to change and update our nursing curricula. And I just wanted to share an initiative that's being completed in the state of Connecticut that I'm involved in, that is an employer-driven curriculum. We are focused on the certified nursing assistant, and we receive money from our state of Connecticut Department of Public Health through the CARES Act. And this was actually to focus and minimize the practice gap between school and when they seamlessly transition. And we're fortunate enough to partner with 3 lead employers in the long-term care space. That's the sector that was chosen by our Department of Public Health. And really engaging the employers and understanding what's the current role of the CNA and what are the competencies, especially with the impact of COVID. Looking at those competencies and turning that into curriculum, not only didactic, but through actually 48 hours of immersion. Our 3 employers are fully engaged in ensuring that those clinical experiences while they're a student develop their competencies and skills. And we're actually going to be providing full-time employment for these CNAs who go through our brand new curriculum. And once we evaluate it in early of 2022, we're actually going to go to scale and offer the CNA curriculum statewide, specifically for long-term care. Based on this model, we're planning to replicate this type of education transformation for all settings: home-based care, home care, as well as acute care and community care, because our employers are actually demanding that we really reframe our education to meet today's needs. And this transitions right into the staffing challenges that our employers are engaged in at this time. You know, when you look at the insights and trends that are currently happening and the staffing and workforce challenges, Jana, as a representative and clearly our board president of the National Forum of State Nursing Workforce Centers, you know, what are the workforce centers looking to do to address turnover, retention, to make sure that we retain our top talent?
That's a great question, and thanks, Marcia, and thanks for having me here. Just to kind of give a little bit of background, just like what Susan just did, Let me tell you a little bit about the National Forum of State Nursing Workforce Centers and Nursing Workforce Centers as a whole. So there are about 36 different nursing workforce centers in the United States. We don't have one in every state. We have one in quite a few. The role of a nursing workforce center, it really depends on your state, and it depends on the state, that it depends on the different structures that you have with your government or with your associations or whatnot. So there are some nursing workforce centers, like the Center for Nursing in Oregon, where we're a nonprofit organization. We are independent of any of the other associations or any kind of government agencies. However, our job is to convene and provide that hub in our state so we can really communicate across a lot of different channels, make sure that everybody is not duplicating efforts, and we're really trying to work together and collaborating. I believe that the Connecticut Center for Nursing is kind of the same, except you also work with the National League for Nursing as well. In other states, you might have a Center for Nursing that's embedded as part of your Board of Nursing. You might have a center that's embedded as part of your Nurses Association, or you might have your center that's embedded as part of your state government. It just depends. And it also just depends on the kind of things that they work on. There are a lot of states that work on specifically collecting data about the supply of nurses in their state, the demand for nurses in their state, and then the educational pipeline of nurses in their state, and what those challenges are, really hyper-focused on what's going on within the state. There are others that are connected to the organizations that are collecting that data, but what they're trying to do is take that data and make it actionable and try to identify those trends, just like you were talking about, Marcia, identify those trends and act on them and convene the appropriate stakeholders together to try to make sure that the data is not just sitting on a shelf or just not sitting on a web page for somebody to look at and say, oh my, that's bad, and then not do anything about. So that's really the role of the workforce centers. So I think that depending on what state you're in, you might have a different experience. However, the role of the National Forum is to be able to connect people to those experts within their states. If that makes sense. So the role of the forum is to connect all of those centers for nursing together so that we can all coordinate together, make sure that we can just learn from each other. And I think that's one of the most powerful benefits of the National Forum, is just the ability to share with each other and look at ways that we can adapt innovations to other places in the United States. Because like Susan said, we also have the goal of making sure that every single person in the United States has access to a really highly trained, highly professional, high quality nurse whenever they need it, wherever they need it. So that's kind of what we do. And now I completely forgot your question. So the question you had was about what are some of the trends that we're seeing as far as workforce is concerned?
Yes,
there
please.
is a thanks. I think that over the years, over the decades, there has been a big discussion about shortages of nursing, and I think that we really need to retire that vernacular if we can. And instead of saying that, I would say that right now we're in an absolute nursing workforce crisis, but I don't feel comfortable using the word shortage anymore. And the reason why is the connotation when you use the word shortage is, then we just need to make more. The problem with that is that there were a lot of challenges facing just the nursing workforce overall before COVID started, and now COVID is just compounding on those issues that were already happening. When we're talking in the context of home health, for example, we know there was a lack of nurses that were going into home health before the pandemic. That was absolutely happening. And now with the pandemic, when people talk about, oh my gosh, we need to get nurses, guess where they're sending them? They're sending them to acute care. And they're really pushing them to get into acute care, because what we hear on the news is about what's happening with COVID and what's happening with the pandemic. And that is bad, absolutely. And those people are not going to stay in the hospital forever. They are going to be needing to go to a long-term care, and eventually they are going to want to recover at home. So where are the nurses that are going to be able to do that part of care? That's one thing that we are really looking at, is we are looking at that what we're calling a maldistribution of nursing workforce across the state, across it's across the country, it's across your state, there's a maldistribution, and it's across different settings. And really understanding that nuance, I think is going to be really important as we go into the future. Yeah, I think that's something that we should really kind of take that context as we go into whatever we're thinking about what the trends are with nursing workforce and nursing workforce in home health.
Thank you, Janet. That really is a nice overview and a really reframe and a new lens in which to look at it, because shortage means that we're not producing enough. Although right now, I know in Connecticut, our Connecticut Center for Nursing Workforce, we do look at data, and we have looked at data for educational capacity for both our RN programs at the Associate, Baccalaureate, and Accelerated level, and then our licensed practical nursing programs. For our LPN programs, we do have enough educational capacity. So we have people who apply, we're accepting probably about 84% of them, and they do seem to fill the roles currently expressed by our providers. Although I've been on calls within the last month and a half and been hearing now that our acute care partners are looking at redesigning their care models on their units, really blending the RN, the LPN, and unlicensed assisted personnel or patient care techs. So now all of a sudden we have a tug in a different area that we have not ever noted an increased demand for, that Connecticut needs to respond to. So I think that's critical when we're looking at our LPN production. What we do have a challenge with in Connecticut, and this has been for years, although we're at our lowest, we only accept 23% of our qualified nursing applicants. We had 11,000 applicants to our RN programs this year. We can only accept about 3,000 of them, and then we graduate about 2,700 of them. So all of a sudden we have a huge throughput issue, because clearly our state is demanding more than 2,700 new grads, so they in turn could move up and skill up their existing workforce. Susan, as we're really discussing this, I think the whole lens of health equity, really looking at how we can support our employers. I know that the Future of Nursing 2030 had some really wonderful elements to support us in doing so. Would you mind sharing a bit about that for the health equity, social determinants of health?
Sure, and I want to agree with the supply issue. So I always say that the country has an insatiable demand for nursing. You know, we have 4 million nurses. It's how are they used? How are they deployed? I found it very interesting about the LPN. I've become increasingly interested about LPNs. And this report, by the way, does speak to LPNs for the first time. The first report talked more, I think, more about acute care nursing. This one that's looking at the future of nursing in terms of health equity is from 2020 to 2030. So it's another blueprint followed up on the first one. And it does, first I should tell you what we mean by health equity. And I'm going to read you the definition that Robert Wood Johnson Foundation uses, which is incorporated in this report. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. So these health equities are often associated with what is also known as the social determinants of health. I'm sure most of you, if not all of you, have heard of that term, because these obstacles have enormous, powerful impact on people's health and the effectiveness of the care that we're able to provide. So that's what this is about. And certainly COVID, this report was supposed to have been issued before COVID. So it was extended because of COVID, knowing that we needed to really take a look at that, including nurses' well-being, which is a part of this. Also, I want to speak to that in a moment. But it does, again, more than the first report, talk about long-term care, home care, behavioral health, public health nurses, school nurses. It's a broader view, I think, than the first report, and really speaks to nurses' roles across settings in a way that it hadn't been before. It's important, I think, that we think about diversifying the nursing workforce, which has, at this point, taken, I'd say, a major major focus of almost every organization we're working with. How do we really diversify the nursing workforce? People talk about it. We've been doing a lot around that, we meaning the center and the campaign, trying to look at how people of color often are getting in, although you point out, Marcia, some chilling statistics about qualified applicants being turned away, which happened 10 years ago too. I mean, this is really a problem we have to deal with, and we should. I don't understand why we can't, well, I know some of the reasons, but we really have to take that on. But many of them need help staying, being retained in schools. So we have been working with federal organizations, with many of the nursing organizations, talking about Black, Hispanic, as well as Native American students, and how do we help mentor them and help them stay and graduate, and of course take the exams and get into practice. And we've seen some successes in that, and we are continuing. AARP itself is going to be putting more energy into this. But it's certainly, we know that there's been a tremendous impact on nurses' well-being, and this does speak to it. And of course, everything that's in this report has to be evidence-based. That's the National Academy of Medicine, that it must be. So there's got to be research documenting this. And it does offer some ways to improve nurses' well-being. But we know that we are in a crisis now, as we keep saying, but it was true before. And I think it will be true when this becomes endemic more than going away, no doubt. And so it does offer, I think, and I just think that trying to help leaders in the home care industry, as we're looking at now, and across the healthcare industry, helping them see what the possibilities and the tools that we can offer for them as employers. And I can talk more about that, but I know that you need to keep moving on.
Thanks, Susan. That's a wonderful reflection, and I think seamlessly transition. I know, Jana, there's a brand new initiative through the National Forum related to how to support our employers at all levels with better understanding what the data talks about within their specific state. And Jana, you mentioned, and I mentioned as well, that we do have a minimum data set on education. And so that really looks at our students within different programs, as well as available faculty, and faculty is a large issue. We have a minimum data set for supply, which really shares with how many licensed nurses we have in our states and where are they practicing. And then you will look at, Jana, demand. How do we forecast demand, or how do we work with our employers to get demand data so we can be proactive in making sure we are focusing on those education pipelines that are so critical. Would you like to highlight the brand new program that the forum's coordinating?
I would, and I actually just put up my screen. I want to make sure you guys can all see that. Can you see the map of the United States? Excellent. So yes, exactly. Over the years, one of the initiatives, actually many initiatives, but one of the initiatives that we really worked on is is developing minimum data sets. And the idea there is we want to try to collect as much data as we possibly can and have it be uniform across the state so that we can start comparing apples to apples as opposed to the apples to grapes or whatever we've got going on. One of the things that but even though we've created these minimum data sets for supply and demand and educational pipeline, not every state is using them. And so it's really hard for us to get that standardized level of data that we want. There are some questions that have been implemented, and we have partnered with the National Council of State Boards of Nursing. Every year they do a sample survey of nurses across the United States. They use many of the questions from our minimum data set so that we can standardize that data. This is the best that we have right now, which is frustrating because it seems like it's 2021, we should have better than this, but this is what we've got going on. I think it has a lot to do with, again, why there's multiple different centers. There's multiple different needs. There's different needs for every state that you're in. So we want to be respectful of that. One of the things that we have been doing over the last year at the National Forum is we've been putting together this data visualization, which we are going to launch in November. So it's not available now. If you go to our website, you will not see this right now. And in fact, I broke our website yesterday. So for all those people that are going to be watching this later and you go to our website, it will be amazing. If you go today, so let's talk about this. So this is going to be available on at the end of November. And what it is this is the data from that sample survey that we do across the United States. And what you can do is you can use this as a way to just kind of get a general idea about what's going on in your state and what's going on in your region. So an easy way to do it is you can look at the counts and you can say nurse licenses. And what this does, this is going to show you how many registered nurse licenses are in each state. And it can tell you where the concentrations are. The darker the color, the higher the amount. So if I hover over California, you're going to get the number 44,964. If I hover over Iowa, you're going to get 55,355. If I go to our smallest state that we have, you're going to get Wyoming, that has 9,213 nurse licenses. You can also change it to look at who your LPNs are. Since with home health, there's a lot of LPNs that are working in home health. Same kind of thing. You can see that in California, there's 102,851 nurses that hold an LPN license. And in Wyoming, there's 964. So you can see this also shows what I was talking about with the maldistribution. The needs of the people in California are going to be vastly different than the needs of the people in Wyoming. And this can visualize that for you. Another thing that I wanted to get back to is we're talking about health equity. One of the things that we are able to look at is we're able to look at ethnicity and we're able to look at race. And so we can say that of the nurses that answered the survey, you can kind of see where they're working. And this isn't too surprising, but you can see the nurses that said that they identify as Hispanic, they're primarily working in the Southwest. If you also go down and look at, you can click on race, and for Native American, the nurses who answered the survey and identify as Native American are primarily in this part of the country. And you can see that that makes up 6.6% of the nurses that answered the survey with this question. 6.6% of them in Oklahoma said that they were that they identify as Native American, as opposed to Utah, where it's 0.0, but that's probably because there's another number after that. So it's probably 0.012 or something, but it's still so small. This just gives overall broad strokes about what you can look at regionally. You can also go down here and see the different kind of educational degrees, where they started and where people ended up, who has non-nursing degrees. And what I also wanted to point out is we can also break it down by specialty. We can look and see where the home health nurses, registered nurses working in the United States. So you can see that there are quite a few over here in the northeastern part of the United States, which makes a lot of sense if you look at the number of the demographics of the people who are, the percentage of respondents who said they were 65 and older. They're also in the Northeast. So if you're doing home health in a gerontology kind of situation, that's where you can see that that's what it looks like. But you can also hover over and you can see that there's 2% of the people in their specialty said that in Oregon said that they were working in home health, whereas in Idaho it's almost 5%. So that means, to me, that says in the Northeast there's a lot more people that are using home health services. On the West Coast there's less people, except that there are in these states, which these are states that might have other home health programs. So while this is not, when we talk about workforce planning and the utilization of this tool for your workforce planning, the way you use this is you look at this and try to determine, like, okay, so what questions can I figure out from this? Like if I were to look at this particular map, I would say, why is it on the West Coast there's less nurses that are working in home health and there are more that are working in the Intermountain West? And why is that? And then you can start digging into what are the policies about home health? What are the regulations about home health in that area? What are the number of agencies? And to get that level of data, you need to call the nursing workforce center in that state who has all that information, or they can connect you and get that information for you. It's helpful for workforce planning because then you can also understand, this is the people who said that they were going to retire. We talk a lot about workforce demographics and how there was a silver tsunami and the number of nurses that were going to be retiring was going to be just overwhelming. That's absolutely true in New York, and it's not true in other places. And I know, but this is the thing, is I could look at this, if I was in Oregon then somebody could call me and say, where are all the retiring nurses? And I can say, oh, they've retired and we've replaced them with younger nurses. But that is not the case in New York. So the reason why this tool is really important is for that, is if you're doing your workforce planning and you're trying to think about how do you recruit and retain your workforce, it is getting into the nuances of what is the education that people are being taught in school. And it's also, what are the regulations that are happening in your state? What are there barriers to people joining home health? It's not just that they don't want to or they don't know how. Maybe it's that there are other kind of barriers, and then you can start looking at addressing those. So this will be on our website. It will be amazing. Probably around November, we're going to get this all set up, but you can see this on our website, yeah, in November, and be able to, and this will be available for you to use.
Janet, thank you so very much. And I think the ability to break it down by specific sector is so important, but also geography. In Connecticut, we have what's called workforce development boards, and there are 5 of them, so they cover our geography. All states have workforce development boards. But what we did was, because we had the data, Jana, related to the education and supply at that time, they wrote a grant to the federal government, Department of Labor, and also Health and Human Services to say, here are 10 different roles, entry level, that we need filled within our geography. And this was Bridgeport down to Greenwich, so the southern portion of our state. So they used our information. Plus, they engaged our Connecticut League for Nursing to actually have nurses be teachers in their workshop week. So before participants could be engaged in their newly formed program called the Health Career Academy, they actually wanted participants to be mandated to go through this workshop week so they knew what healthcare was all about. So we ran a core skills training. We also ran a customer service and diversity training so that the participants had a great idea about healthcare, value-based purchasing, home health, acute care, and long-term care before they were selected for the program. So Janet, the data is vital to share with our non-nursing stakeholders and our government and quasi-government agencies to inform them on how to align and focus on those roles and educational pathways that are essential for filling their vacant positions in the state of Connecticut. So believe it or not, that entity, it's called the Workplace. Over 10 years, they received $25 million from the federal government. So for those home health agencies who are on today, there's a huge resource for you to reach out to your local workforce development board. Sometimes they're called workforce investment boards or WIBs, and see what type of programming they have going, how you as an employer can really engage in their work. Don't necessarily have to be part of the training, but you can be one of those employers who are willing to hire and provide clinical opportunities for their participants, because that is a huge resource, not only just for CNAs, but the grant that the Workplace had, the Healthcare Academy, it also was for nursing. So it was a huge boon for the southern half of our state to get qualified individuals. Monies are also available through HRSA, Health and Human Services, Department of Energy, Department of Commerce, and all of this new money is coming out. Build Back Better, as well as other federal programs coming through the basic agencies. I did want to share that if you have not been on the website called grants.gov, that's where they post all the available grants. And actually, there was a wonderful resiliency grant that I believe the date just closed yesterday or maybe even this Friday, but really to put funds forth for employers and educators to really look how we can enhance the resiliency of our staff. Millions and millions of dollars. So you don't need to go it alone. As Jana alluded to, you can partner with your local AARP, you can partner with your workforce center, you can partner with your trade association for home health and home-based care within your state, or even as a region, to really look at what those critical issues are and how you have some capacity to influence and enhance your workforce. I would like to also share just a little bit about what's happening in Connecticut. Even though we're a very small state, as I alluded to with that small grant we're working on for CNAs in long-term care, our state had received about $1 billion, very small state, for CARES money to really impact, to support entities and businesses and individuals impacted by COVID. So our CARES money has been expended to date, but we did just get about another $1 billion for the American Rescue Plan. And so in Connecticut, they've earmarked over $70 million specifically for workforce development, not just for healthcare, but for all sectors. But being involved in the process, I'm actually coordinating a statewide post-acute care group with both trade associations in the state of Connecticut, national and Connecticut leaders, to really look at what are the short-term and long-term initiatives that we could stand up in our state to positively impact and stabilize the workforce for long-term care. This easily can be mirrored for home health and at-home care. We are also wrapping in the Connecticut Association for Healthcare at Home. Many of you know Tracy Wodat, who is the CEO of that organization, but there are federal funds to support that. Through your apprenticeship programs, millions of dollars are coming into your state. So I'd be more than happy to, as well as other executives of workforce centers around the country, to work with you and provide you some resources. I know that AARP has a wealth of resources that also can assist you. I'd like to turn it over to Susan to share a little more in depth of what AARP, the Future of Nursing, and the Center for Champion Nursing is doing at this time. Susan.
I was saying Connecticut really is an amazing state, I have to say. I was just listening to the National Academy for State Health Policy Conference, where I serve on the board there. And yesterday, I think it was the day before, Dawn Lambert, who is a state official, was reporting on workforce, basically, and what they're going to be doing with the money, the ARPA funds you just talked about. And she talked about something that I'm now spreading quite a bit, that the projections they have been having for the balancing of home care and nursing home care, we call that balancing in Medicaid, was projected out. They've been doing this for quite some time, projected out to at least like 2035, 2040, something like that. And in 1 year, because of COVID, instead of jumping like 1 or 2% a year where you would shift more to home care, it shifted where it should be in 2029. So you jumped in Connecticut alone 8 years in the projected demand for home care. This was under Medicaid, as I understand it, which would require 10,000 more home care workers. So it was an amazing contribution. And so what you're going to be doing in Connecticut is spectacular. What do you do right now? What do you do going forward? Spectacular. And there are other states too. AARP, that's one of the things we are doing in terms of resources, tracking those funds and seeing how we can put states together and, you know, collaborate in different ways. Specifically to health equity, we have on our campaign, it's campaignforaction.org, for anyone who wants to just look on that, a resource that is called the Health Equity Toolkit. And it's really, we did this in collaboration with other nurse leaders, other experts in equity. We've revised it already. So it's free, you can download it. And it's very much action steps of what you can be doing for individuals, communities, healthcare professionals, what you can specifically do. Has an assessment that employers can be using. And they can learn more about social determinants of health, what that really means, etc. We also have had a series of health equity action forums, very profound. Hundreds of people have been on these action forums, and they are all, you know, saved, and you can access them also on our website. And they really are just like, what are people doing? And people don't want to talk about it; they want to do things. So finding out what they're doing is really very helpful. And then we also have, in relation to this report, the National Academy of Medicine report, we have collected information from across the country through several different forums that we've been having to put together an action hub. So what is going on around the state? And you can click, it has templates. First of all, we're putting more about what states are doing, not just states, what organizations are doing, what employers are doing, anything we can find, we're putting it out there. We're not filtering it, we're not editing it, we're just putting it up there so people can learn from it. It also has templates that you can use, you can download it, and thinking about how you can have conversations with other organizations, sort of what do we think we should be doing? What do you think you should be doing? How can we collaborate on that? And it's very much, it's not about nurses just working with nurses. This is very much multi-sector work. It's not just interprofessional work, it's multi-sector collaboration, which, you know, nurses generally had been, you know, talking more with nurses. That's what people do. They, you know, lawyers talk to lawyers, teachers talk to teachers. It's not that we're bad, but this really is pushing us to talk way past our comfort zones to be able to do things. And I'm also excited to say that we have created at AARP the AARP Center for Health Equity Through Nursing. This is brand new. I'm just starting to announce this. It'll be an umbrella organization so that, and the Center to Champion Nursing in America and the campaign would be within it, but it's broader than that because AARP itself is doing a lot on health equity, a lot. So this would put it in the bigger context of AARP. And one of the things that AARP is focused on is employers, not only healthcare employers, but employers writ large, and wanting to identify perhaps in the next year or two, 10 large employers that want to partner with us to address health equity and making equity, by the way, also financial equity, making equity very core to making workforce decisions, for designing corporate policies, implementing workplace innovations, and again, looking in particular for communities of color and other vulnerable groups. So again, I think employers we need to keep looking for what are the well-being, nursing well-being, other healthcare professionals well-being, what are some evidence-based solutions to that, and share that through our website and through any way we possibly can.
Susan, great comments, and I just want to do a huge shout out regarding your hub. So as having two boards to work with, the Connecticut League for Nursing and the Connecticut Center for Nursing Workforce, and being part of, I know Jan and I were both part of those work groups to look at the recommendations and come out with short-term, long-term, and sustainable planning. I've actually taken the nursing education, the data, the health equity, lots on DEI, and actually sent those action plans to my board to say, okay, how are we going to enact it? So related to our nursing leaders on the call today and those from home health, you really can look through all of the 54 recommendations, pull out those that resonate for you, and automatically you have action plans of what to do. And I know we're going to be getting to in about 5 minutes what are the low-hanging fruit and actions you can do as an employer. I did see a question from Bonnie. Yes, we know some of our acute care partners have $25,000 signing bonuses, hanging their shingles out for seasoned employees, but also new hires. And we know that a lot of employers cannot compete. And so in about 5 minutes, I'm going to reflect to Jana for some closing comments from data, but we'd love to address how you can positively position yourself as an attractive and robust employer for those new hires, but also seasoned nurses. So we will definitely address your question. Thanks so much, Bonnie. Jana, just wanted to turn it back to you.
Well, I'd be happy to address that particular question, because one of the things that we are seeing in the data, and it's interesting because there's so much quantitative data that we still can't get because we're in the middle of the pandemic and it is not done yet. So it's like every single time we capture some data, it changes. So we have to, it's really frustrating. So what we're working on is qualitative data. One of the things that you'll see in the resources that we provided is something that we do in Oregon. It's called a Friday huddle. Every single Friday at 8 a.m. there is a Zoom call where nurses in Oregon, and not just nurses, but people from our health authority, people from our state board of nursing, people from our workforce investment boards, and nursing students, and just anybody can show up and talk about whatever they want. And what I really enjoy about that particular thing is that we are able to identify some of those things that are happening in the workplace right now and what they can do about it. Last week, in fact, we had someone from a home health agency come on and talk about just the absolute challenge. It spoke exactly to that. How in the world can we compete with a $25,000 bonus when we don't have that kind of money, and we are just in need of staff like everyone else? What we are seeing, and the data is showing, is that when we're talking about the well-being of nurses, there are nurses that are so burned out of acute care that they will go and work in home health. There are some nurses that can't work an acute care schedule because of family obligations, because of, you know, not just children, but adults that they are responsible for caring for. So don't knock yourself out and think, oh my gosh, unless I can offer these huge financial bonuses, I can't compete with that. You can compete with that if you adjust your culture and recognize that this idea that we have had over the decades of you leave your life at the door when you walk in and then you do your job, that doesn't exist anymore, not for anybody. Keep in mind also that, what I'm trying to say with that is, that means that somebody who's walking in the door might have a kid at home who's under quarantine because there was another kid who showed up on their bus that had COVID. And so they're trying to figure out, well, how do I do the daycare and also show up to work? Because I need to show up to work, but I've got a kid who's quarantined. Those are the kind of things that I think employers need to be very cognizant of. Change your policies if you need to, and recognize that there is some flexibility that the entire planet needs right now while we get through this particular crisis. Now, also keep in mind that if you are, it really, really is about what kind of culture can you create? Can you create a culture where it is supporting each other? It is paying a livable wage, a good wage, but you're offering the flexibility. All of the human resources literature that we have looked at, even over the last 25 years, have talked about those things are almost more important than money. And particularly right now, we need to also keep in mind that we are living through something they're calling the Great Resignation. And the Great Resignation is across the industries, across all industries, individual people are reevaluating their lives. They're reevaluating what's important to them. And they're getting away from this transactional relationship that they have and embracing more of humanity. So that means they're not going to work at a job where they feel uncomfortable, they feel overstressed, they feel like the work environment is toxic. They're not going to work there. So as employers, what can you do to do an evaluation of your work culture? What can you do to look around and say, what kind of team building do we have? I know that sounded really, really crazy 10 years ago. You're like, I don't care, it's the job. They should come in and do their work. We don't live in that era anymore. We need to move into the era of we're supporting each other as human beings that are trying to get through a global crisis that is not going to end anytime soon. Even as the disease becomes endemic, the fallout from this, especially for nurses, is going to last a long time. So from a home health perspective, you guys are just look at your culture and you'll be able to beat those $25,000 bonuses, no problem.
Thank you, Janet. And I was going to sum up with some low-hanging fruit and answer a couple questions and then turn it back to Deb Hoyt. But just as you said, Janet, how are we going to boil it down? What resources can our home health agencies and home-based care adopt? And I said the low-hanging fruit to build your workforce. Like you said, go back to the basics. Reflect on your mission and vision and identify the type of employee you wish to attract. Create that profile so you can effectively assess your volunteers, your future employees, and how your culture contributes to attracting those applicants. I just read a quote the other day, came across my email. It says, the culture of an organization is shaped by the worst behavior the leader is willing to tolerate. So what are we projecting to our volunteers, our new hires, and our staff? We can't always ensure, as you alluded to, the top salary, the most robust benefit package, or the most state-of-the-art technology, equipment, and resources for our patients and our residents and our staff. But what we can do, as you alluded to, Jana, is create that positive workplace culture and environment where employees are valued, they know the work that they do and the impact that it has not only on the lives of their patients, families, but also, as you alluded to, the team. Related to recruitment, we did talk about some just general information, but one of the things that we didn't talk about is creating a partnership with your local school of or program of nursing or allied health. Identify the roles that you're seeking and reach out to those schools or educational institutions. They are so interested and hungry to build relationships with you and understand your workforce needs. It would really behoove you to understand what's their timeline for acceptance through graduation and plan accordingly. As Jana alluded to, review your hiring practices. Do your hiring practices allow you to hire someone before they sit for the boards? Or will you only hire someone who has passed the boards? I think, as Jana and Susan reiterated, if you do the latter, you could be missing an opportunity, because we are not producing as many new grads. And this is at all levels, whether you're searching for a CNA, an LPN, RN, an advanced practice nurse. The earlier you can create relationship with the schools, the more apt you are to be able to give those students some insights. So where could you begin with giving your schools and students insights? You can coordinate shadow days to socialize your students to your healthcare organization and the setting. Home care may not be, just like we found out long-term care. Our students don't think long-term care is sexy. That's why they don't go there. But if you ask them, they all want to take care of, pediatrics. And so unfortunately, when they think about, okay, what's the patient population of acute care, it's mostly geriatric. But if you ask them, do they want to work in long-term care? The answer is a definite no. So how can we provide those shadows? What kind of volunteer opportunities do we offer during the summer or even the academic year? Is your organization willing to host some clinical experiences? Schools come with their own faculty. They can bring in up to 8 faculty, or 6 faculty, depending on 6 students, depending on the numbers you're interested in. But giving those students an opportunity to see your patient populations, experience home-based care, the value and rewards that go with it, the ability to establish effective communications, not only with the patients, but the families. And I think Susan, through AARP, has phenomenal resources for caregivers within to stand up programs. And so that's a beautiful complement. There's also capstones and immersions that you can share with schools that you're interested in hosting, which is a one-on-one opportunity. So you can actually, once you know the characteristics of who you're looking for, match that with one of your staff, have them go on different visits, but also pick an area of research, because as part of the capstone or immersion, that student has to do some research. So that student can actually be doing some research that you've always wanted conducted, and they can feed that back to you to inform practice and create more research and evidence-based. And then lastly, what's happening in Connecticut, we're creating joint appointments. This is nothing new. It's been around for a long, long time, but the school will actually pay one of your employees as a clinical faculty. So your organization can receive students, and sometimes the salary may not be the same as the hourly rate that you provide your nurse with, but you can backfill that marginal difference. You'd create a consistent pipeline of students being exposed to your organization and your environment. And so when you're looking for new hires, having those students who have been engaged in your workforce will be a seamless progression to your environment. Doing one of these activities well will actually bear more fruit than trying to stand them all up without appropriate resources. So there are plenty of opportunities to engage the student at all levels to bring them in. And I think that goes to Bonnie's question of how do we stand up to that $25,000 signing bonus? I think it contributes directly to Jana with the Great Resignation. I mean, you don't go Fast Company Inc. magazine without seeing that, and clearly it's permeating healthcare across all roles and across all settings. When you look at the resources that the Center of Champion Nursing, as well as AARP and Robert Wood Johnson and some other major funders are looking to support nursing workforce development, how can you be an active player and an informed voice? You know more than anybody else at these workforce development tables related to home-based care, home care, and your book of business. Now is the time to shine and share your expertise. I know that Axxess actually just published a report. It came across my desk this morning, but my printer got jammed, so I couldn't look at it. But it was information on recruitment and retention for the industry. This will give you some standards and benchmarking information that you can give a national view, but also based on JANA, dig in your state information. Arena asked, gee, how can I get information in my state of Connecticut, in my state of Pennsylvania? We know, is it Laura Hexum, Jana, who's the president of the Pennsylvania Action Coalition? But you could
it's Jenny Horn. It's
yeah,
Jenny Horn. Jenny Horn is the president. She's the head of the Pennsylvania Action Coalition, and Sarah Hexum Hubbard is part of the National Nurse-Led Care Coordinate Coalition, and they've got amazing resources there too. So if you're in Pennsylvania, go look for those people.
Yep. And Arena, we're going to be sending you a list of resources, not only from what AARP has been engaged in, and we cannot thank Susan and her organization enough for how they've leaned into healthcare, but nursing in particular. And Jana has resources on the National Forum. I also have resources for both the Connecticut Center for Nursing Workforce and the League, which showcases the programs that we've done, so you can get some ideas of how to position that within your state. And I just can't thank Axxess enough for providing a forum for nurses on a national scale and our organizations to help support and inform you not only in your daily work, but for your overall nursing workforce planning. I'd like to turn it back to Deb Hoyt to wrap up. And again, thank you for sharing your hour with us, and we hope you found it to be valuable and informative. Deb.
Wow, thanks, ladies. Marcia, that was a terrific wrap up. I couldn't do a better job in terms of mentioning some of those actionable ways that everybody listening today can get the assistance they need. Jana mentioned the National Forum of State Nursing Workforce Centers website and that nice, beautiful map that you could hover over and click on, look at the detail for your state so that you can take a look at how the redistribution of nurses and other clinicians at different levels can help move us to where we need to be in home-based care. I really like what Susan talked about in terms of what AARP is doing to make sure that people are going to be able to choose home. That choose home legislation is something that the home-based care industry is pushing in partnership with AARP, and we're so delighted that we're partners on this because Congress needs to make a decision so that people that have had a hospitalization can choose to recover in the home, and that's what this is all about. We will be able to have the workforce that we need. It's going to take some time. It's going to take some work. Marcia said that home-based care agencies can go talk to the education centers, whether it's the nursing schools or other opportunities within their state and their community to say, how do we train these folks? How do we find them? The workforce centers in your own state have people ready, willing, and able to be able to transition to new types of industries and roles. There's funding there for us. There's proctoring. There's all kinds of internship opportunities and shadowing that Marcia mentioned. So this was a very action-driven and data-driven conversation that I don't think we've really had up until now. So I appreciate you ladies greatly. Marcia Proto, Susan Reinhard, and Jana Bitten, you've offered so much. We'll be having a handout in the chat. It'll also be sent to you with a link to the recording of this webinar. And I'm hoping that you're going to take this webinar and sit down with your HR team, sit down with your clinical team, sit down with people in your community, and actually listen to this together and say, we can overcome this and we can do this, but we need to put our heads together and work together in a way that can tap into the funds that are available, tap into the psyche of the people that are trying to find flexibility in their work and life schedule. And I think that home-based care is truly going to shine. We're positioned perfectly to be able to grow and expand. It's just that we need those people to be able to take care of those people that need need clinical-based care in the home setting. So thank you to all of you. This was extraordinary. I hope that everybody enjoyed it. I want to thank Axxess for hosting this event. They'll be posting it on YouTube. After you conclude this webinar, there'll be a pop-up that comes up in terms of a short, brief, I think 4 or 5 question evaluation form. And if you feel that you need to reach out to any of the presenters, I know they'll make themselves available to you by email and provide you guidance, but please look for that reference page. It has all the links that they mentioned as well. So with that, I'm going to say thank you to everyone, and we appreciated all of your time and attention today. This is an ongoing conversation, and hopefully we'll be able to do a follow-up in the next 6 months to a year to see where we've come. And I think that we'll have made a lot of progress. Marcia, thank you so much. Susan, thank you. Jana, thank you. It was so nice to see all of you on one screen. We've got wonderful national experts here that we were so fortunate to have. Have a wonderful day, everybody, and we'll hopefully see you somewhere soon.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.